Good afternoon, everyone. Happy Friday to you, and welcome to our media briefing today. We'll get right to it with our guest, Deneen Gus, our superintendent of schools in Monterey County, and she's going to delve into the challenges that our schools are facing with reopening. Deneen, thanks very much for joining us on the briefing today.
Happy to be here. Thank you so much for the invitation to participate today.
And I didn't even have to tell you to unmute. You're so connected.
Well, as you can imagine, we are living in the world of mute now. So, not in the world of mute, but in the world of Zoom. And we're getting really, really good at muting and unmuting. So
anyway, I'll let you get started. I know you've got a lot of great information to share today.
Yes, I just wanted to share with all of you that our schools, as you know, prior to the governor making his announcement last Friday, were working very hard to get our schools open to some type of in-person instruction. They had been following the CDC guidance, the California Department of Education guidance, the state public health guidance in regard to reopening schools to in-person instruction. And then last Friday, the governor announced that schools that are in counties where the local health jurisdiction is on the watch list will not be allowed to open their schools to in-person instruction. They'll have to remain on the distance learning model until they're off the watch list for 14 days. And if there is a school that is in a watch list county, they can apply for a waiver. And if the local public health officer approves that waiver and the state public health officer approves that waiver, then those schools would be able to open to in-person instruction. Of course, following all the health and safety protocols. Students would have to be social distanced. They would have to follow the face covering requirements. So we're not talking about opening schools like it was normal situation, that we weren't in the middle of a pandemic. No, that is not what we were talking about. We're talking about in-person instruction in a modified setting where all health and safety protocols could be followed. So that's the change. And if you have any questions regarding the waiver process, I can share with you what I know, and then I can turn it over to Dr. Moreno, who may have more updated information than I have right now. But as of today, what we know about the waiver process is that a school who would be interested in applying for a waiver would first have to consult with their teachers, with their union leaders, with all of their staff members, with parents, and with community members. And after that consultation, if they still feel it is safe to open to in-person instruction, then they would submit a request for the waiver to the local health officer, who would then have to look at the epidemiological data for that school in that area. And then if that waiver is approved at the local level, it would go to the state level. Now, I do want to mention that this is only for elementary schools. The waiver is only able to be given or granted to elementary schools. Dr. Moreno, do you have any updated information regarding that waiver process?
Hi, Deneen. No, I think you covered it very well.
Great.
All right, great. And so great to have you both here on this subject today. Dr. Moreno is available for questions. He's not going to make a presentation, but can answer questions on this topic and anything else that you might have. So I've got some questions already in chat, and I'm going to go ahead and read the questions for the people who are watching on YouTube. I know people who are on the Zoom can see those questions, but you'll just have to listen to me read them anyway. So let's get started. This question is for you, Deneen, I think. How will Monterey County schools go about offering elective courses such as band, art, drama during distance learning? Will they or will they not be able to offer those classes?
So in the distance learning model, I know that some districts are planning to offer those courses, and other districts are still figuring out what that might look like and if they would be able to do so. So you would be amazed how creative and innovative our teachers and classified support staff have become through this entire distance learning time frame. We do have teachers who are teaching art via Zoom or Google Classroom or whatever their learning platform is. We do have some music programs who have been continuing to operate. Believe it or not, you can even do ballet classes via Zoom. Everyone has become very, very creative. So again, some schools will be offering those courses if they have found that innovative way to do so, whereas others are still, I think, researching and figuring out what that might look like and how to do that in the virtual world.
All right, and I have another question for you. This particular reporter asked about the waiver process, which you already answered, but he wonders if you're aware of any Monterey County schools that are planning to apply or go through the process for a waiver.
Yes, I am aware of one school district that has already submitted their waiver request. They're a school district that is located in a very remote area of our county. The students that attend that school live up in the hills in the Big Sur area where they don't really interact with the general public very frequently. It's a very small school district. In fact, I think they only have maybe 6 to 8 elementary school students. So they have a very small number of staff members, a small group of students, again, very remote, very isolated. They have already gone through that consultation process and submitted their waiver to Dr. Moreno.
Thank you. And then another question for you, Deneen. Has MCOE identified students without a device to conduct distance learning, and what could MCOE do about that?
Oh, great question. Thank you so much for asking that question. Yes, we know that there are 12,500 devices that are still needed in order for us to serve our students here in Monterey County. And we also have many students who lack reliable internet. So that is another challenge. What MCOE is doing to address that issue is we launched a digital divide task force a week after we went into the school closure mode. And that task force worked to identify short-term and long-term solutions to this problem. We have been working with all the vendors who provide services. Many of those vendors have been so generous. They have been offering free internet to some of our families that did not have internet at that time. And others offered low-cost internet or came up with some kind of special plan that would reduce the price and support our students and our families. We do have many school districts now who are handing out Kajit or hotspots, which basically is a device that would help a family that does not have internet connection to have that internet connection. Some of our schools have also turned their Wi-Fi service out to the community so that students and their parents can drive up into the parking lot of that school and be able to access the free Wi-Fi. We also have MST, who has been parking their buses at various locations throughout the county, allowing families to drive their vehicle up near the bus and access their free Wi-Fi. And the library system across Monterey County has also turned their Wi-Fi out so that the general public that needs access to internet can drive into their parking lots and access their Wi-Fi. Now, this digital divide task force that I'm sharing, or I'm talking about right now, has also raised, as of this date, $520,000 to purchase devices for the students and families in need. Those devices are being checked out to students through their schools. So it's actually the school that has the device in their inventory and checks it out to the student. That way the schools can maintain the device long-term. Once we give a device to a student, as you know, things sometimes go wrong. The device may break and needs to be repaired. And so it's important that the school maintain the responsibility for that particular device. So the Digital Divide Task Force has been working very, very hard. We are so thankful for all of the local foundations and contributors who have been really realizing that this is such a great need in our county, and they are stepping up to the plate. If I can give you one example, I know we have many donors, and I'm so thankful to all of the donors. I'm so very appreciative, but I have to do a shout out for Bruce Taylor. Immediately when we launched this task force, he called us and he said, "What is the need? I'm here to help." And at that time, the needs were still coming in, and what we thought the need was going to cost about $202,000. He immediately wrote a check, gave that check to the Digital Divide Task Force. Those devices were purchased. They've already gone out to the schools and out to the students. That was just no hesitation, just such generosity on his part. Again, we have many other donors who also have been contributing, and the need, we thought we could immediately get those devices out and then the need would be over. But what we have realized is that we continue to see more and more need, because some people I think people thought that maybe this was just going to be like a 3-week problem, or that schools were only going to be closed for a month. And when everyone realized that, no, this is a long-term situation, then more and more device needs have come forward.
Thank you very much for that. This is a follow-up question to your earlier discussion about what the school that's planning to apply for a waiver. Of course, everyone wants to know what district, or are you able to name the district?
Big Sur Unified. Mm-hmm.
All right, thank you. And then I have a question for the health department, and this could be for Dr. Moreno and possibly Karen Smith, the PI, who's also on the call. Dr. Gray commented about testing at this past Wednesday's press conference, and this reporter wants to know, what is the status of testing sites and pop-up sites? At the Optum sites, are they only going to take those who fall into top level or top tier priority groups that Dr. Gray mentioned who should be tested?
Karen, do you want to start, or do you want me to go ahead and try to reply?
You can start if you want. I can talk about Optum if you want.
Okay. So as far as priority groups, we've had priority groups for some time now, and California for testing, and California Department of Public Health from time to time updates the priority list. And the priority list is intended for both healthcare providers who are deciding which individuals, which patients should be tested or need a test, and try to distinguish people who need a test from people who want a test, I think. And the laboratories likewise have an opportunity to further develop their infrastructure to be able to receive specimen swabs that come with a priority designation by healthcare providers, so that they, if they have to choose which specimens to run first, they can run the higher priority specimens first. So that's it's going to take additional, I think, infrastructure development and enhancement, and implementation of protocols and policies at both the healthcare provider and the laboratory levels. So that's I think what's possibly we can anticipate seeing as we move further into this pandemic. As far as the impact of the prioritization list, or different tiers that CDPH has been putting out and updating from time to time. We at our public health laboratory here at Monterey County continues to focus primarily on the tier 1, which is the highest tier, highest priority specimens from patients that come primarily from our hospitals and also from our skilled nursing facilities. And we also will prioritize specimens that come from congregate living facilities that are experienced, some congregate living facilities other than skilled nursing facilities that require quick turnaround for decision making. One example that was is our current response to the increasing cases at the Monterey County Jail. And so we continue to receive specimens and run those in and return results within a day or two to the jail. And so that's an outbreak that is on the top of our priority list. And so we have capacity, so we're running those lab tests in our laboratory. So I'll leave the explanation of OptumServe to Karen.
So in terms of Optum, we are still accepting people who don't have symptoms. The biggest concern with Optum right now, honestly, is the no-show rate. We've had no-show rates that continue to climb. So again, if you make an appointment, please show up. But it has allowed us to take some people who are symptomatic as walk-ins. The state sites had a contract for Optum with the state has been extended to August 31st, but as that's the ever continuing question is how long will they fund it? And that's still a squishy question at the state level. Our partners at Planned Parenthood are still doing their sites at MPC twice a week. And then the health department has engaged the services of Visiting Nurses Association to do pop-up events in areas that we have found have been underserved in terms of testing. So they're having their last day in Castroville today. And I believe the next place will be Marina. So watch for that. And I think that pretty much covers it.
Karen, did you address the part of the question about whether the Optum sites will be asking people what priority they fall under, or are they going to continue to take all those who make an appointment?
They will continue to take all of those who make an appointment.
Right.
I would encourage people who have questions that, they think, oh, I don't know whether I should get tested or not, to call their health care provider or call one of the hospital hotlines to find out, really what they should do.
All right. And then this is another question for you, Karen or Dr. Moreno.
May I?
Yes, please.
Can I just add one more thing?
Yes, please.
Yes, I do want to also comment on testing with regards to the number of tests that people receive. And that is that once a person tests positive for COVID-19 with the PCR tests, those are the tests that are done at hospitals in our public health lab and the commercial labs, then there really isn't, from a public health perspective, there really isn't a need, and there's no recommendation to have follow-up tests because once you test positive and you get over your illness, you're out of isolation, you're no longer, public health believes that you're no longer infectious anymore, and that's why you've been released from isolation, you can return back to work. And a repeat test after you've left isolation and you're feeling well can test positive for 1, 2, sometimes even 3 months after your illness. And it doesn't mean that you're infectious anymore. So we won't put you back into isolation, we won't restrict you from work. And so there really isn't, from a public health perspective, a need to have a repeat COVID test once you've already tested positive.
Thank you for adding that, Dr. Moreno. And here's another question about labs, kind of differentiating commercial labs and our county lab. How many labs are there in Monterey County that are actually processing COVID-19 specimens? And then what is the daily capacity for processing at the county lab?
Sure. So the number of labs, there's at least 5 There might be more. So that would include our public health laboratory and our 4 hospitals. Our 4 hospitals have the equipment that to run the tests that are quicker. And the turnaround time for them is faster because the test is being done while the patient waits in the emergency department, for example. And so we have those 5 laboratories. The laboratories in the hospital are still dependent upon receiving from their vendors the test kits to run the test. So their test kit availability can wax and wane over time. So if they are low on test kits, they may call over to our lab and ask if we have capacity to take on some of their tests until they get more test kits delivered from their vendors. And if they're well supplied with their test kits, then they can take over more of their testing from their patients in their emergency department. So 5 that I know of actually in the county, and there might be 1 or 2 more, but I apologize. I'm not familiar with who else is doing the testing.
Thank you. And Karen, this may be a question for you about Optum Sites, where the Optum Sites are located, and are we aware of how testing supplies are holding up at the Optum Sites?
Okay, so currently in Monterey County, the 2 sites are in Salinas on Abbott Street at the Agricultural Commissioner's Office, and in Greenfield at the Greenfield Library. So far, Optum has been managing their supplies across the 87 places they have test sites. So far, so good. But they've got a large pool to pull from and have been managing it fairly well. But that's why there's a limit to as 132 per site, because if you overdo it at the beginning of the week, you might run out of things at the end of the week. They use a just-in-time model.
Thank you. And then here's another kind of a broad question about testing. What efforts is the county trying to take, or can the county take, to address problems with testing results coming back 7 or more days later? And I think this is in reference really to the Optum Sites and the commercial labs.
Yeah, so I can begin to respond to that question, Maya. So from the time a provider or the time that an OptumServe employee decides to swab someone, that specimen has to be transferred to a laboratory that has an agreement with that provider. And if it's not being done in-house, like at the hospitals, then it's got to go out of house, so to speak. And so OptumServe and some other providers our clinics, for example, are sending those tests to LabCorp or Quest or other commercial labs. So there's transportation time, and then if the demand for testing exceeds the capacity of the laboratory, then it may be several days before the laboratory can actually process the specimen. So that's another area where there's turnaround time is impacted. Those lab test results, once they are available, are sent to the healthcare provider in order to alert the patient, and then they're sent to public health, either with a fax or electronically. Sometimes it's the same day, sometimes it's 1 or 2 days after the provider has been notified. So once we get it, though, we do our best to get these confirm that they're cases and get them assigned to investigators. And so our challenges as a community are to improve turnaround time are there, and the opportunities are also there. So that at a variety of stages of processing specimens and reporting and acting on test results. So what is the county doing? The county, as I've mentioned with this group before, I'm on calls with the state every week, and we express some of the challenges that we're experiencing with the state health officer and our leadership team, who then And we do have some people who are on the state testing task force who participate in some of our meetings. So we express our concerns, our needs, and the hope that at the state level, there can be some, and at the national level, there can be some strategies implemented that increase the capacity of our commercial labs to decrease the turnaround time, which benefits us in terms of notifying patients of their status, and also allowing us to get to contact the cases sooner to make sure that they understand they have to be in isolation. So that's not in our control, but we are trying to influence and impart to those that do have control the need to decrease the turnaround time at our commercial labs. What's in our control is the case investigation and contact tracing. And so we continue to work with our director, Elsa Jimenez, and our HR Human Resources team to bring on supervisors who can supervise, train and supervise additional case investigators and contact tracers. So we're up to, I think, 70 individuals now who are trained to and participate in case investigation and contact tracing. So that is in our control, and we continue to do our best to meet the demand for identifying these people and getting them into isolation or getting them into quarantine, and working with them to determine and provide, if possible, the support services they need to successfully complete their isolation or quarantine.
Thank you very much, Dr. Moreno. I have another question related to Optum, and I think this is a question, Karen, you talked a little bit about the no-show rate at the Optum sites. Can you tell us what the current no-show rate is at those sites?
It runs between 30 and 50%, so it's very significant. It depends on the day and the site, but between 30 and 50%. And luckily, we can take that up in walk-ins, but still, that it makes it very difficult to plan. And for people who want to make an appointment and get a guaranteed spot, it makes it difficult for them because it fills up spots that people are not using.
Yeah. So, Karen, I would just add that I think that our colleagues in the media can help by also reminding Monterey County residents that if they make an appointment with OptumServe and for whatever reason they can't keep their appointment, that they log in again and cancel or reschedule their appointments, because that could free up an appointment for someone else that needs to get tested.
Thank you. And Dr. Moreno, I know you have to drop off the call, but I have a last question that I think you can answer. Do people getting repeat tests affect our positivity rate? Or is it one person, one test? Or however many tests they take, one person?
That's a really good question, and I don't know that. I know that I don't have the answer, but I know who does. So
all right, and I think I know too.
I'll try to. I'll pass that on and see if we can get that out to a response to this group.
Yeah, and in fact, I'll forward it for the reporter who asked. I'll forward this question right after the briefing and try to get that answer for you.
All right, thanks.
And then, Karen, hopefully you can answer this one. If the turnaround rate at Optum or a pop-up site is more than 3 to 5 days, is it worth it for someone with no symptoms to be tested?
Wow. I would say unless you are a contact of someone who is positive, or you have some belief, or your healthcare provider has told you, as long as our rates are as long as our return or turnaround times are as high as they are for the Optum sites, I would be very careful about using them just testing to be testing. The VNA sites, we've only had one group that we've done, and they've turned around quickly, and they're going through a different lab. So the Optum sites go through several labs, and they have been working on moving moving and adding more labs to their testing so that times can come down. But the VNA sites so far have been like 48 to 72 hours.
So this again follows up on the advice you gave earlier about really talking to a doctor before you attest, as opposed to just making an appointment. Would that be the best advice?
Yeah, my advice is if you're concerned, call your healthcare provider or call one of those. Call one of the 3 of the hospitals have hotlines, and you can call and talk to a nurse and really get your questions answered and put your mind at ease, and then maybe not have to stand in line or sit on pins and needles about your test results.
All right, thank you. That's all the questions that I have on chat. I am not seeing any other questions coming in. Are there any people who want to just ask a question the old-fashioned way? If not, I'll give it a minute here to see if anybody's chiming in or writing anything in. And I see nothing, so that will end our briefing today. Happy Friday to you. Our next briefing will be Monday, and we'll see you then.
Have a great weekend, everyone.